What's up, everybody? Welcome into the Performance Medicine Show. I'm going to let a few people get in here. I see One Step Forward. Roel, what's going on? Great to see you. Love to see some of the regulars in here on these Tuesday evenings. We are live on YouTube, Facebook, and Dr. Rogers' LinkedIn account. Welcome in. We're going to let a few people come in, and then we're going to get this show rolling. We're going to have a really fun episode today. For those who don't know, my brother's going to be joining me, Andy Rogers, and he is our PA over in the Johnson City location. And you know what? It's just going to be fun to hang out with him. I haven't gotten to do this with him. He was on the show a month or two back with Doc, and I'm kind of excited to get to hang out with him tonight, and I think you guys will be as well. Say hello if you're new here. Let me know where you're from. We'd love to connect. It's great to see everybody. I see Lisa. I see Bianca. What's going on, guys? So good to see you guys. Lisa, thank you for sharing. Really pumped. Lisa had such a great success story last week. Thank you for sharing that, Lisa. Yes, Bianca. I'm excited too. He's getting ready now. So pumped to get to answer some health and wellness questions with the bro. Fabian, what's going on? Fabian is from San Diego, Texas. Is that a thing? I would have thought San Diego, California. Maybe there is maybe it's San Antonio, Texas. Sharon, what's up? Robin, hello. Great to see everybody. We're going to get Andy on here shortly. Let's see here what we got. As you guys know, we send out the Performance Weekly newsletter every single Tuesday. It goes out around 3 p.m. And this was a really fascinating episode of the Common Sense MD. This went up on the YouTube channel as well as all of our audio platforms with the Common Sense MD. It's on the HR5 saliva pathogen test. Dr. Susan Creech from Colonial Heights Dental Group has been on the show before, and this was a follow-up. They went over Dr. Rogers' saliva test as well as talking about some of the controversies in dentistry, which I found to be fascinating. They talk about amalgams, root canals, fluoride, where bad breath is coming from. Super interesting episode if you guys have not checked that out. On Explain This, the star of the show, Robin Riddle, who is our nurse practitioner in the West Knoxville office, really opened my eyes. Last couple have opened my eyes, actually. And this was on artificial food coloring. And the gist is, guys, it's not good. And one of the bummers for me was ketchup. Oddly enough, I'm a ketchup guy. I love me some ketchup. And Robin was like, you gotta stay away from that ketchup. There's better types of ketchup that maybe isn't as pretty. It is San Diego, Texas. Goodness. All right. A buddy of Roel's. A buddy of Roel's is a buddy of mine. So Fabian, welcome in. So glad to have you here. Roel, man, thank you for spreading the word. You're such a gift to the show. Thank you so much. Alice, what's up? Great to see you. Jack, I see you. See my grandmother Mary is in the building. See her two grandsons up here tonight. Sharon, what's up? Great to see everybody. We had an episode of Dive Into Diet. Do you guys look at the stuff going on the YouTube channel? This was a part 2 episode with my main man, Lucas Schmidt. He's our nutrition coach in the Johnson City office. And he's talking about cilantro, mint, and bay leaves in this episode of Dive Into Diet. It's a part 2 to this one right here, where he talked about basil, rosemary, and thyme. part of these things, part of doing these shows is me working on my pronunciation, and it is time. And this was last week's episode of Explain This with Robin. And phthalates or phthalates, I'm still kind of iffy on it. Phthalates, I think it's phthalates. But a lot of great stuff went up on the YouTube channel today. Molly, what's up? Great to see you in here. Thank you, Alice. I appreciate that. We're gonna, I'm gonna put that up here because let's see here. Where's Alice's comment? I've already lost it. Shoot, this is Alice's. Pretty soon, I'm going to be the second most handsome guy on the show tonight. With Dad here, I'm kind of, I feel like I'm number one. But with Andy coming on the show, it's going to be, I'm basically just going to succumb to it. I'm number two, and I get it. And when, Ike is in here, Ike, I'm like a distant third. Margot's in the building. Margot is our PA in the Fountain City location, which is where I'm at tonight. Great to see you today, Margot, and thank you for hanging out with us tonight. So good to see everybody. We're waiting on Andy here. I hope that I gave him the right information. He's getting ready to head into the green room. We're going to get to it. Let's see. Thank you, Alice. I'm pumped for tonight's episode. We're going to have a blast. I'm still unsure if we're going to be able to see the fan favorites. Alice, not Alice. Alice is at the Blake. Izzy and Ike. I don't know if we're going to be able to see them tonight. We'll see. Amber, what's going on? You know what, Amber? I'm going to do this real quick because I got to give Amber a huge shout out. She was in our newsletter this evening, this afternoon. Let's see if I can find this. Everybody can check out Amber. And now I cannot find it, Amber. I'm going to have to save that for a minute. I lost my thumbnail. Amber is going to be injecting in our West Knoxville office as well as our Fountain City location. We're really pumped about building out that side of our practice here in the Knoxville area. So stay tuned for that. Shoot, Amber, I thought I had it somewhere, and now I can't find it. It was so good to have you in here. I hope Ava and Isla are with you. Shout out to the twins. Let's see here. What else we got? Real quick, a little housekeeping for those who are close to an office. We've got Father's Day specials happening all week next week. And it's going to happen. Is it? No, it's not. It's not next week. It is next week. Goodness, guys. We got to get shopping for the dads out there. It's coming up June 12th through the 16th, all locations. We're going to be running specials on the services there in front of you. If you're listening on audio, we're going to do some specials on VitaTrim, the P shots, testosterone shots, Evolve Physique, oral therapy, as well as the His Wave. Super pumped about talking more and more about that as we get close. Happy early Father's Day to everybody. I see Dave's here. What's going on, Dave? So good to see you as always. Let's see. Where else are we at? Who am I missing? If you're new, let me know. Let's see. There we go. Thank you, Amber. Ava and Isla, what's going on? Great to see you on the show tonight. Let's see. I'm still trying to figure out where the bro is. Oh, there he is. You guys are going to be so pumped. The bro is in the building. He's in the green room getting, I see he's doing his hair, getting everything ready. I told you, Alice, I'm going to be number two when it comes to looks tonight. Number two, and I'm happy with it. Andy, give me a thumbs up when you're ready to roll, and we'll get this thing rocking and rolling. If you've got a question for Andy, go ahead and put it in the comments. We're going to be taking questions all, this entire hour. So I'm pretty pumped about this. Angie, ready, man? He's getting there. He's getting there. All right, you ready? Cool. All right, thank you, Molly. I appreciate that. I mean, this took some time. I do this for my grandmother Mary. She got upset with me when I had the hat on.
Oh, hold on. Okay, hold on. Let's get rid of that light. Hold on. Is that light too much? That
Guys,
light's too much.
what do y'all think? Is the light too much?
Hold on. Is that better?
Dude, you look great, man.
Hey, stop. No, mom's going to be so mad that I don't
She
have
will
the
be.
right lighting. Okay, but I also don't like have the thing, you know, the thing that gets on, you know what I mean? I got headphones. I don't have like the glamour light that you have.
Can I do a quick little intro?
Please, I love it.
Guys, I am with my brother, Andy Rogers. He's our PA over in the Johnson City location. You might have also seen him on Dancing with the Stars in Tri-Cities. You were victorious a couple years ago as well. Give a shout out to the theater that we're so fond of over there in Jonesboro.
We do love the Jonesboro Repertory Theater, the JRT. They've been very good to. They've been good to me. They've been good to you, Ben. They've been very good to you.
They've been very good. One thing I just want to put out there is that I am Andy's biggest fan. I go to every single one of his shows, his talks, and I'm just glad you're on the show tonight, man.
Hey, thank you. I'm going to tell you this right now, ladies and gentlemen. My mother is going to kill me that the light is like this, because she told me on the way here. She's like, make sure the lighting's good. But I did fine with this. I'm not drinking alcohol. That's great. I've already eaten. So come on, what more can we do?
Honestly, that's pretty good right there. Like, that's 2 for 2.
You can hear me, right? Yeah, you can hear me. So that's good. So I'm yes. Hey, there's some Amber's in the house. Amber, I'm so excited to see her. I'm so excited to. I got to see Amber a couple weeks ago. I was so excited to see her down in Knoxville. And Molly, oh good golly, Miss Molly. Molly and I have been talking all day about this event tonight. So
really,
yeah, we have.
Molly, be honest. You're here for Andy tonight. I know you are.
She is. She told me.
Okay, I knew it. I knew it. You know what? You see, we got Candy in the building. Candy, what's going on?
Candy's up. Man, y'all got some peeps. Oh,
we got Jack in here. Jack's excited to see Andy back on the show.
I'm so excited. So the Candy and Andy show, that's going to be next, Candy. That's it. We're ready for our YouTube sensation.
I love it. So what do you say? We're going to get into some questions here. As you guys know the drill. We had questions that came in throughout the week. We'll go over those first. And then if you have a question for Andy, put them in the live comments. We're going to get to every single question tonight. I see Alice has got a question. I see One Step Forward on YouTube. Thank you guys in advance for going ahead and put those in there. See, Alice has got a great question about pellets. Terry, my man over in South Carolina, great to see you. Dude, we've got Texas in the building tonight. We've got Texas.
Wow. The other UT. I love it.
The other UT is in the building. Yeah. All right, so let's go ahead and get started, guys. I like starting out with a Mounjaro question. One, because it's like top of mind for lots of different people. Two, we have a ton of success stories that are with us in the audience. Lots of people have lots of success with it, but we have heard about, maybe some correlation between Mounjaro and ADD. What's your thoughts on this? The question is, this came on Instagram. Why does Mounjaro help with ADD?
So, this is a proposed mechanism. Whenever a new drug comes out, it's going to have an indication. And when you have an indication, you can bring something to market and it's indicated for that one thing. So with this, with all the GLP-1s and now GLP-1 and GIP, another gut incretin hormone, they're finding out new things. So to indicate it for diabetes, because as you agonize the GLP-1, GIP receptors in the gut, insulin becomes sensitized. People lose weight, but also have a reduction in A1C because it works on insulin. It has a lot of different mechanisms because we're finding out that that hormone is not just in the gut. It's actually in the heart, which is why drugs like Ozempic and the newer ones, Mounjaro might have that indication in the future. It doesn't have it now. Improves cardiac health, but it also too, we're finding out that, yeah, it is helping out with ADD. I've had a lot of comments and feedback from patients that it actually helps them feel more energized. My guess, and this is an educated guess, is that GIP receptors, just like GLP-1, live in the brain. And GIP has actually been associated with some ADD type symptoms or ADHD type symptoms. So if we're having a dysfunction with GIP and now we're agonizing it to work better, ADD and ADHD are going to improve. So much of that with psychiatric medicine is qualified by the DSM-5 criteria. So you're looking at, do I fit a certain number of symptoms and a certain number of situations that has a decreased quality of life, and does it affect my activities of daily living? So a lot of it's based on your subjective measures rather than objective measures like a lab value. So my answer to this would be probably because of GIP, and that's what makes it different than any of the other drugs in that class, that it hits a new receptor. And two, they call it the Twinkerton because it looks like this, and it hits both GIP, GLP-1, but it hits GIP way more than it does GLP-1. That's why I think it helps out most with that.
That's really interesting. The way I would take it and what you're just saying is you'd still use it for weight loss, and this is kind of a side effect where it might help with people's focus, that sort of thing. Is that kind of, because you're not going to use it for ADD, I don't think.
No, so too, I think that will be a future thing. In fact, too, if a Mounjaro rep were on here, he'd be like, wow, thank you so much, but it's actually indicated for diabetes, and a secondary side effect would be for weight loss. It's going to be indicated for, it's already been fast tracked to be approved for weight loss, but all those become side effects of primary indication. I think they'll do more studies. They're finding out that a lot of these drugs that affect like diabetes, the pathogenesis for like diabetes and these chronic illnesses, like improve the brain. And it makes sense to me too, because a lot of these things, why these drugs work, like why Mounjaro works for so many people without diabetes. And I explain this in the room a lot. There's mild age-related insulin resistance. Insulin just doesn't work as well as you age. So when you make it work better, a lot of other functions become better too. That can be said the same way with the brain. The brain ages while you age too. And so if those receptors, we just don't hit them as much as we get older. So I feel like that's probably why people are feeling more energy on it, are focusing better. I don't know if that will necessarily be an indication for a young person with ADD or ADHD, just because the stimulants work really well. It is interesting to note too, stimulants decrease your appetite. So does Mounjaro. So there's some crossover.
I'm going to put this up here from Molly here because, obviously we're talking about Mounjaro here. Molly's asking about Ozempic. I'm thinking it's because the GLP and the GIP and the Ozempic only has the GLP, but I'll let you kind of explain this one.
So I haven't gotten that feedback for focus. I really haven't. So I would say probably not as much. The feedback I get more, and I won't tell the Ozempic reps this, but is that people actually feel more tired on it. People tend to feel a little bit tired on Ozempic. It's not true with everybody. A lot of times Ozempic works very well for people with energy levels, especially as glucose improves, if you're actually treating for diabetes. But I don't get that feedback. There are GLP-1 receptors in the brain though, and Ozempic at a certain dose crosses the blood-brain barrier. And I believe it might, I could be wrong. I'd have to look up the PI, but it might be at 1 milligram that it has to cross the blood-brain barrier. So I wouldn't associate it more with focus, that particular one.
All right. Thank you for that, Ange. Great question there, Molly.
Great question. Molly with the win. Alley-oop. Whoop, whoop. Throw me those GLP-1 questions. Don't get any hard ones. Jeez. And here's a hard one. Okay.
And here's a vertigo question. I love this question because vertigo is something that is so devastating and difficult to deal with, and it actually comes up quite a bit. So I'm going to put this out here. So it's a long question. I'm going to give you some context, Ange. The question is, been dealing with vertigo for 6 weeks. After CAT scan, MRI, and extensive ear testing, all came up negative for my symptoms of vertigo. My last ENT suggested my brain is overreacting. Wants me to go on a migraine diet for 12 weeks. I do not have migraines or headaches. He did not like my supplement list I take. I got some context. She is taking our recommended supplements for the 60 plus age group. So you have daily access to a Beamer mat, which I have read is similar to like an Avicen, an infrared sauna, an amp coil system. Question is, what do you suggest for treatment and what supplements would be beneficial? Also, is this something I could do for a phone consult with someone in your group? I do not live close by, and that's a perfect question for you because I know you're in charge of our telehealth program. Tell me what your thoughts on this. What would you suggest here?
That's a tough one. First off, thank you for that question. And I'm really sorry that you're dealing with that. There's a lot of things I don't wish on people. Vertigo, dizziness, that's one of them. It's uncomfortable. And two, if you've ever experienced that, it's just not something that you want for other people. I do feel that is a huge umbrella question. That's one where it's the differential diagnosis is pages long. It's not usually oh, your hormones are off. Let's replace your hormones. You're in menopause. It's not an easy question, nor an easy thing to work up. So you've gone through imaging for it. So whenever you're looking at causative etiologies, what is causing this? You think, is this anatomical? Is this biochemical? Is this neurotransmitters? Is this inflammation? Is this traumatic? Did you have head injury? Two, is it iatrogenic? Is it something that you're taking? A lot of side effects of medication will have side effects of vertigo. My suggestion for this would be, it's extensive ear testing. That's something called a Dix-Hallpike test with an Epley maneuver. So when you're looking at vertigo, you're kind of looking at the inner ears. That's the vestibular system that is joint space positioning and your balance. That, in addition to what your brain says, creates your position in space. They call it joint space positioning. I think making sure that you have a good practitioner who's done the good ear testing. I actually had a patient come in with really severe vertigo. She's been worked up at Vanderbilt, and she's had different opinions from every neurologist and every ENT that she's gone to. I would say too, so Dix-Hallpike test is to see if there's nystagmus. So making sure that you have a good practitioner, they take your head and push you down basically and see if your eyes go like this. That's nystagmus. And two, to see if there's associated hearing loss or ringing in the ear, tinnitus or tinnitus. Those have different causative etiologies of vertigo, like Meniere's disease. I do think it's important too to have definitions. Dizziness is the umbrella, vertigo. And so there's different types of dizziness. There's vertigo, disequilibrium, there's presyncope, and lightheadedness, which are all different things. Vertigo is the room is spinning. Disequilibrium is I'm off balance, but not necessarily the world spinning in front of me. Presyncope means before passing out. It's that feeling of you're about to pass out, that lost feeling, which can be described as dizziness. And then lightheadedness, it's more of a vague feeling of feeling almost like out of body and not connected to the earth, all of which have different causes and different treatments. I think MRI and CAT scan, that's going to look for anatomical reasons. So is there an acoustic neuroma? Is there something growing in your brain or your brain stem that's causing your balance to be off? With those being negative, it's probably not a tumor growing, which is a good thing. Extensive ear testing is going to see if there's an imbalance with the canalus or the rocks that are in the vestibular system. And two, also to see if there's fluid buildup. A lot of the times, I'll tell you, with vertigo, it's fluid. So when this practitioner told you to go on like a migraine diet, a lot of that is just a very low inflammatory, low salt diet. Salt and water are like best friends. And so when you decrease your salt, you're decreasing your fluid. And that type of fluid, a lot of times practitioners will put you on a diuretic and your vertigo will go away. So fluid is one thing that I would work on with decreasing your salt, watching fluid intake. Sometimes they say decrease caffeine, decrease alcohol. Those tend to increase the fluid, especially within the brain. It can cause that dizziness. Another thing too, is to try some medications. Sometimes it's doing like prednisone and seeing if it's inflammation or inflammatory in nature. A short course of prednisone can just decrease the inflammation, which then can decrease the vertigo and you get out of a flare. Other testing that you could do is like a carotid IMT that's going to test and see how much blood flow you're getting to the brain. So it's almost like an ultrasound of your carotids on both sides to see if there's any narrowing that can cause vertigo. A CT angiogram to kind of see what the blood flow looks like in the brain to make sure it's stimulating all parts of your brain. Seeing a really good ENT. We have a really good ENT in this area. I love Dr. Zience's group, ENT Associates. They're the bomb. So making sure a good ENT is on board. Sometimes I'm just giving you everything I know about vertigo. Yeah. I'm sure I'm like going off the rafters, but sometimes they'll do anticholinergics or benzodiazepines. So benzos like Xanax, Valium, those actually can kind of calm the vestibular system, which can then get you out of a flare. You don't want to be on those long term. There's a drug called meclizine or Antivert, which is like an anticholinergic drug, and that works against acetylcholine, which is a neurotransmitter in your brain that can also cause, if that's overactive, that can cause vertigo. My first suggestion would be absolutely try the migraine diet or look for low salt, low caffeine, low alcohol, like a very low inflammatory diet. That will help, but that also helps anybody. A further workup, I probably suggest getting a carotid IMT, which you can get at any outpatient center. We do it at our Kingsport office once in a while, just to make sure that blood flow looks good. And then two, trying out with a practitioner some of the Epley maneuvers. That kind of helps reposition the canalus, even doing a short course of prednisone. Two, can we take care of this over telemed? Yeah, like if anything I've been taught, Dad always says, try something. So we can absolutely try something. And we might not be able to get to the bottom of it that quickly just because we're not with you and can't see. I do think it's important with vertigo to see what hearing is and what your vision is, and does it accompany headaches? It says you don't have migraine or headaches, so that's not with it. But I like the Burma mat. Infrared sauna is amazing. Infrared sauna will decrease toxins, but also too, well, it kind of gets you to sweat things out, and you'll lose salt that way. So that's probably a good thing. I'm not sure about the AMP or the AMP coil system, but I would have to look that up. But I'm sure that cannot hurt. Supplements for vertigo, there's not a great supplement list that's specific to vertigo that I know of. I'll look that up and see if there's anything specific for it. I would try the diet first.
That it looks like the migraine diet. Okay, I really hope that helps. I know that's just a terrible thing to go through. So make sure you keep us posted on how that's going. Try some of those things that Andy suggested. Andy, great explanation.
And that's what And I see Alice in the comments for vertigo, go to physical therapy and get flipped. That's like an epoy. That's like they reposition all that stuff. Even there's something called benign paroxysmal positional vertigo. And so you look up and you get dizzy. That's a common way to kind of like, you honestly just learn how to position your head and kind of reposition the canalus in there.
Thank you, Alice, for putting that in there. Again, if you guys have any suggestions, things that have worked for you, put in the comments so we'll make sure that this listener can get some of these ideas. All right, we're going to go to this one here. This is an estradiol question. The question is, it seems that this person's on hormone therapy. Why would my estradiol number have decreased this month if my dosage was increased? A little context for you, Ange. I was very consistent to apply every single day and always at the same time, which was the evening, and also did blood draw at the same time of day. Some numbers, it went from 49 to 28 in 30 days, which seems pretty significant to me. What's your thoughts on this?
Yeah, so my initial thought would be creams are notoriously variable, notorious for being variable. I'm not surprised by seeing a number of 49 go to 28. It is significant, but I'd say too, especially with increasing doses, I would venture to say you'd probably stay around the same or go up a little bit. I'm never surprised with creams that it doesn't just always go up. With the pellets, there's just not a ton of room for error. And not that you're doing anything wrong, but when you apply something on your skin barrier changes all the time. Even at the same spots, you can have different absorptions based on how open your pores are. So too, I even talked to a compounding pharmacist, and I have a patient that does it on a wrist. I'm like, can they do that? Yes, you can. You just get it very fast, because if you think, that absorption is like right there. So we do it on the inner leg or inner thigh or back of knee. Because usually those creams have testosterone in it, and you can have abnormal hair growth at the site of administration. So that's an easily hideable, shapeable place for abnormal hair growth. If it's just estrogen in there too, you can play around with the places some. You'll get faster absorption here on the wrist, but you usually have to do it twice a day because it's in and out more quickly. I do think too, it's not something that's routine with our clinic, but I would look at the formula of your bias. Usually when we're doing estradiol cream, we're having two forms of estrogen, estradiol and estriol. So you might have a different formulation. It's usually 80% estradiol, 20% estriol. Sometimes we do a 50-50 combo for patients that may suffer from migraines associated with estrogen, or with when they used to cycle, they used to have migraines. A 50-50 combo works well. And usually that estradiol number doesn't go up as much because you're having more estriol absorption. Things to consider is changing to the pellet if that's ever part of budget or interest, because you usually get better number results that way. Or two, I always say doing it after a shower. Your pores are open, you have heat, so heat allows pores to be more open, and so you might get better absorption if it's right after a shower, and making sure that it dries before rubbing off or putting on any clothes.
Super interesting. So
Rachel's in the house. I'm sorry, I'm looking at the comments. What up, Rachel?
Rachel, I can confirm. Andy is my favorite brother. You're number one. Am I number one to you?
Rachel has to put up with me every day. Every day. It's like Groundhog Day. Oh my God. I'm in a song. I get in song modes right now. It's been the Pina Colada song. Every day I go through phases, but sorry, I just had to tell that to Rachel. Anyways, with that, changing up space, so maybe trying a different part of your body, actually, to see, trying the pellets. I think pellets are amazing. Our granddad was, yes, you are my favorite brother. That's a side note, of course. Granddad always say, if you have a choice between a shot and a pill, take a shot, because it's gonna be in. They just work better. Same way with the pellet. And I never say that too, because sometimes creams do work for patients. I've had patients be on very low doses of creams and their estrogen skyrockets. Very different per patient. And two, different times of year. Your skin changes with the season too. The dermis that's why I say the creams are notoriously variable. So I'm not surprised by that. But if you want to stick with creams, I would say try out different places, do a hot shower, see if your pores are open, and see if numbers and symptomatic relief gets better. I'd say as far as numbers, it's significant, but is it super important? Between 49 and 28, maybe not, but between 49 and 80, yes. So we try to hit that 60 to 80 goal, because that's where research and the A4M, where we get these integrative numbers, show that you're hitting the brain, the bones, the heart more for preventative measures. But a lot of estrogen also deals too with symptom relief.
Super interesting. I'm seeing that it went from 49 to 28. Okay. But you're wanting them higher up.
You want them high. Our goals are higher.
All right. I hope that helps. Great answer there, Ange. Let's see here.
Why, thank you, Ben.
Yeah.
Thank you.
I want to give a shout out. I see Tracy's in the building. Tracy,
hey, Tracy, what up?
Frida's here. Frida's got a great question. Thank you. I see Roel's question. These are awesome, guys. Keep those in the comments. We're going to get to those in just a second here. Let's move to the next one here. This is a kind of a environmental thing. You've often told me we live in a toxic world. Any suggestions for non-toxic weed control in the yard? Sure hate to use toxins that we so badly want to avoid, but also don't like weeds. Yeah. That's interesting. What's your thoughts on this, Ange?
So there's a couple different companies. I know these got submitted earlier. So I looked up some. If you looked at my yard right now, you'd be like, you don't do anything to your yard. I get chance to mow my yard. Someone told me the last weekend, I said something about, I was in Arizona. I was like, oh my God, all this dirt and rocks out here. I miss like grass, like having a yard. They're like, you must not be a homeowner. And I went, I beg to differ. I am a homeowner. he goes, do you not hate mowing the yard? I went, I don't mow my yard. I don't mow it. The Rogers boys, we're not like outdoorsy people. You know what I mean? We don't mow. He's like, oh my God, what's wrong with you? So too, there are natural pesticide controls that you can do. There's actually DIY stuff. So I looked this up. There's DIY for your like pesticides. There's an organic garden spray for stuff off of Amazon, Wondercide, Dr. Earth. But a lot of it is like, I think vinegar, and alcohol work well. I'd have to see, but there's like certain weed killers you can use that are all natural that don't have the toxins in them. Especially too when your dog goes. Thank you, Chrissy. Matt put on there. So vinegar is one of them too. Vinegar is a really good cleaner. I've actually been looking at stuff for like getting rid of smells naturally in your house. I have 3 dogs, or like your shoes smell. Baking soda is really good for that, for using in your house. Alcohol spray that's diluted. You can spray your clothes with that. But all these suggestions that you're seeing in the comments are great. A lot of it's vinegar. A lot of it's, that's
super
great.
Interesting.
But too, that's something I haven't used personally, but I do think it's worth it, especially if you're going to be around it. Because when you're spraying, remember all the Roundup stuff?
Yeah. Great question there. Thank you for that, Ange. Great comments, guys, on that. Epsom salts and vinegar. I see Carter's in the building. Carter, what is going on?
Oh,
she's
Carter.
Here. Carter's here.
Carter in the house. Carter in his house.
In the house. So good to see you. All right, let's get to. I love this question because I know you're one that's very good at counting carbs, but also probably counting protein as well. This is a protein question. I'm going to see if I hope I didn't butcher this question. Only whole eggs versus 1 or 2 whole eggs plus additional whites for more protein without all the calories. Goes on to say, I've read some that say the protein is not good if not the whole egg, but some things still say egg whites are good protein also. To get 24 grams of protein in a post-workout meal, that would be 4 whole eggs every day, which seems like too many. So it's questions around, one, is egg white still good, or do you absolutely need the whole thing? And then it's around, the 4 eggs to get you to the 24 grams of protein. What's your thoughts? Just because I know you're conscious about this stuff. So how would you approach it?
Yeah, I think this is a great question. We'll talk about the eggs in a second. Perfect aminos. If you're looking to get the most bioavailable protein, get perfect aminos. That's a company that makes a protein powder that is not like whey protein, not animal source protein. It is like it's better than branched chain amino acids. You're going to get the most complete and most bioavailable and best absorption from perfect aminos. So if you're looking at like, I need the best bang for my buck with the least amount putting into my system, perfect aminos. But do I love eggs? Yes, absolutely. Like we were meant to eat eggs. Eggs got a bad name because of cholesterol. And so two, it raised people's cholesterol. And now we have two, we have a very different approach to cholesterol than most practitioners or traditional health does. You're probably going to get a rise in cholesterol with eating the yolk. So two, that's why people went to egg whites. It's like the yolk is bad. It's the fat, it's the cholesterol. When really, I think the whole egg is better. Get the whole thing. I think it's a good fat. It's a good protein. Two, you're right. It's about 6 grams of protein per egg. So to get 4 whole eggs, that's a lot, but also it's not. I've seen people do a lot more eggs in one day than that. So I don't think 4 is a ton if you're just wanting to get it from eggs. My suggestion would be find a different source of it that's more bioavailable, and you're going to absorb more. You're not going to absorb all that all that protein. It's going to be broken down in your gut prior to you absorbing it. So I'd say find a different way. But also, would I like it? Yes, absolutely. Go ham on it. That's a natural food. It has no additives to it. Know your sourcing of eggs. So two, I would do pasture raised eggs, or 2 local eggs where you know the chickens that are laying it. I know that sounds stupid, but it's worth it because you're getting anything that the egg comes from, anything the chicken eats, you're going to eat too if it's coming from it. So I think getting a very clean egg, it's rich in omega-3s too. I think it's a great thing to eat the whole thing.
All right, great stuff there. I love talking about that because
it's a free food, no carbs, no insulin stimulation.
Yeah. Great question there. Let's get to this real quick, then we're going to move to the live comments. I see questions are coming in. The question is, I know you typically say CT calcium score just every 10 years, but I had one in 2017 and would love to do it again now just for the knowledge. Would you say yes or no to that?
I'd say amen. Amen, sister or brother. I don't know who brought this comment, but I'd say amen. Say what? Yeah, knowledge is power. No, too, if you're getting a CT calcium score every 30 days, too much. It's too much exposure to radiation. It's not telling you anything different. I have seen patients, including I was going to say the Wizard of Oz. I was talking about Dad. I was trying to make a joke, but Dad's CT calcium score has changed over the course of a year. So too, those scores can change, especially every 10. He's saying every 10 years if we're not concerned about certain things. Say if you have a family history where everyone's had a heart attack or everyone's had plaquing, everyone has stents, I'd get it more often. It can change after a year. So I'd say too, if you have over a couple years that are pretty normal, then I'd say span it out so you're not getting so much exposure to radiation. But 2017 to now, absolutely, I would do it. I can't wait to get mine. Dad still says hold off, but I might do it behind his back. Fran, is Fran on here? Can you write that for me? That'd be great. Thank you.
I love it. Guys, we're going to get to the live comments here. I'd like to welcome everybody in if you're new to the show. This is where we take live health and wellness questions, the Performance Medicine Show. So glad to have my brother here, Andy Rogers, with me. Andy, you ready for this? We're going.
Bring it on. Can you hear the dogs barking in the background?
You know what? We love dogs on this show, man. We're totally fine with it.
Really? Okay, cool. Should I, while you bring up the first question, do you want me to bring another lamp over here?
Whatever you need to do, man. I'm going to get things
I'm just going to get real close. Mom, dude,
mom's gonna be so upset at your lighting.
I know. You know what? Maybe can PM spare for another ring light if I'm going to do?
I know.
This? You know what I'm saying?
I know.
We do. I'm getting news out there for everyone. I am getting my headshots redone on Saturday. My last headshot I got done, I looked like this, and I was 22. So time to redo them. I am fully toxed, so hopefully I don't make any expression. That'd be great.
We all want to know, are you keeping that haircut for the headshots, or are we getting a little fresh cut?
Well, actually, what's going to happen is that I can be safely fall from a bike because of the helmet that I have on my head right now. This is a lot of hair. This is brought to you especially by Collagen Gummies, Minoxidil, and Finasteride. Coming to you
There
live.
We go. There we go.
Coming to you live. So I'm never going to lose my hair, but also too, I'm going to thin this bad boy out. I'm going to thin it.
You know what? I'm going to put this up here. I'm doing this for Katie here, and because you're the poster boy of this. You're the healthy, happy hair poster boy.
Yes, do that. Oh my God, healthy, happy.
I can see your face being right next to it. All right, let's get to one step forward here on YouTube. Love a saffron magnesium question. I take saffron and magnesium before bedtime and have no trouble falling asleep or getting into a deep sleep, but wake up several times with minor pain in shoulder and neck. I can take Advil, goes on to say, but would rather not take them every night. Is there a natural supplement that is safe for everyday use? I'm assuming this is for the pain. What's your thoughts on this?
I love talking about sleep. I love it. So I actually work for a company called Idorsia, and I speak on a drug called Quviviq. And so too, I've had to like look at a lot of sleep and what causes disruption in sleep, a lot of which are hormones. So too, making sure that we know what is making you get up is important. That's for everybody. It's like, what is causing you to get up? Are you urinating? Are you in pain? Are you having ambient light? Is a dog waking you up? I've had a lot of things being like, what's actually bringing you up? Is it nothing? Is it your brain racing? So too, if you know that it's minor pain in your shoulder and neck, to anything to decrease the inflammation. So inflammation is what's usually causing the pain. Making sure I would absolutely get that checked out by a PT to make sure that you're having, I had shoulder pain forever. I'm not kidding you. And I always thought like, this is like a weird thing, but I never went to like a PT or like whatever in school because I didn't think tennis players like should. I don't know, like the football players went. And I was a tennis player. Those like, get over it. You know, I didn't get hit, but I had shoulder pain a lot. And it turns out, I had overuse, but I was also sleeping on it. And I only sleep on my right side. And I was digging into my shoulder and my neck on that side. So when I went to Ernie, our PT, I hugged a pillow and slept on my back and pain went away. We're meant to sleep on our backs. Right? Side sleeping is actually not good. I still sleep on my side. It's really hard sometimes to control that. But it seems like our etiology, our pathophysiology is pain in the shoulder waking you up. If you're looking at something natural, I would say do curcumin turmeric. I would do upwards of 800 milligrams, if not 1600 milligrams, like 4 of them a night or a day. That will naturally help decrease the inflammation. That's my favorite. I've had people take as high as like 4 grams of turmeric. Another good anti-inflammatory is omega-3s. I'm doing upwards of 2000 milligrams of EPA DHA. Maybe prescription wise, look at low dose naltrexone. If you're knowing that this isn't from like something you're doing, like sleeping on it, and you have unknown pain in your right shoulder or whatever shoulder this is or neck, and you don't have an anatomical reason for it, like, hey, I have impingement coming out of my spinal cord, or I have previous injury or overuse, low-dose naltrexone is great for just general anti-inflammatory and also great sleep. Even looking at peptides, technically, I would consider them kind of natural because it's a natural sequence of amino acids. I think that will help sleep and also decrease the inflammation and also to increases growth hormone, which helps with muscle repair.
Yeah, I think we're going to talk more and more about peptides.
Peptides are the thing.
They're really, Robin does a great job of going into some of the specific peptides on explaining this. And it's just, man, it feels like it's the future and the future is here.
I talked to, is Mark Milford on tonight? I don't know if I saw Mark.
I have not seen Mark. Mark, are you out there? I've not seen a comment from Mark.
What up?
Huge shout out to Mark. He's one of my brothers.
I love Mark. Yeah. But Mark and I talked a lot about peptides last week, and so too, they're going to be on the rise. FDA is going to crack down on them because they work. Because they work, and two, it's not it's not going through retail, but two, it's an amazing, they're amazing products. I love the peptides. I'm on CJC IPAM right now and love it.
Yep.
Getting ripped by the minute. Like, you know, I'm just sitting here. I'm not even working out. I'm working out right now.
Can we just do a shout out to Grandma Mary?
Kiki's in the house.
She is in the house. I believe, I tell you what, I love the Blake. We got Allison here from the Blake, and she has a good question here. The question is the hormone leptin, I believe is what she's saying, that causes weight loss. Why can that not be inserted into the hormone pellets? And I hope I'm not butchering that, Alice. I hope I'm asking that right. I do believe you're talking about leptin. Let's see if I have any. What's your initial thoughts on that? I guess, right now pellets are estradiol and testosterone, correct? And progesterone. No. And anastrozole.
Wait, say that again. It kind of skipped out. Say that again.
So
I went out for a second. You said something about estradiol. Why can't it be added to a pellet?
Yeah. Leptin, I believe.
Is it leptin or leptin? I actually don't use that one quite a bit. Leptin or leptin?
It's this. Alice is saying leptin, the hormone leptin. The hormone leptin, can it be put in pellets?
Okay, yeah. It's like something to do with like fat tissue. So
I think it does.
Sorry, leptin. So leptin is also a satiety hormone. Ghrelin, leptin.
Yep.
Ghrelin, CCK, and leptin. So like satiety and 2, which was where the GLP-1s work too. It kind of increases satiety. I think that's mechanism. I'm not familiar with it being inserted into a pellet or something that you would. I don't have a lot of people just taking leptin for appetite suppression or for weight loss. That might be something for the future, but too, naltrexone. There's a naltrexone pellet for weight loss,
really?
Which is gnarly. Yeah, you get some really good results off of naltrexone pellets. We've thought about doing that. We just haven't really ventured into it. But naltrexone pellets do exist and can be inserted similar to testosterone estrogen into a pellet tray and then into the hip area. And works great for weight loss. But a lot of that's when you're looking at that, I think it's appetite suppression. So when you're with that, I think the mechanism's different. I don't know about it being inserted to a pellet. That'd be interesting to know. Companies like Wells or Olympia, those would be the ones to look at to see if they even offer that type of stuff. But too, that's something that we need to venture into. Naltrexone pellet, I think, would be awesome.
Super interesting. Thank you, Alice, for putting that in there.
That's great. Oh, and for the Blake, thank you. I love the Blake.
Shout out to the Blake.
Shout out to the grand piano and the bar at the Blake. Whoop, whoop.
I'm going to put this up here from Lisa. Lisa had such a great success story last week. She's lost a ton of weight on, I believe it's Mounjaro. And it seems there is a weight loss plateau. How do you get past that and start losing weight again? And Lisa, if I'm wrong, I do think it's Mounjaro. But she's insulin dependent, so got to decrease her insulin. So huge success here. What's your thoughts about just getting over a plateau with one of these weight loss medications?
That's a great question. So a lot of that too deals with what is your total daily energy expenditure and what is your basic metabolic rate. So a lot of people have a set point. And so we have one set point that we kind of we're at our goal weight or our best weight, our most confident weight. And then two, that can be not mismanaged, but reset whenever we gain weight. So it's almost like we get to a different set point and a different metabolism. So with resetting that and it's almost like you plateau again at this basic rate or set point. I think too, it's kind of like muscle confusion. If you just keep doing yoga and keep doing yoga and keep doing yoga, you're not really seeing much after doing it for a decade and not doing something else. I would change it up 100%. Either change up what you're doing with Mounjaro, like try Rybelsus, Trulicity, Saxenda, Ozempic, just for a couple months, like change it up a little bit and then go back on. So it's almost like you can almost like muscle confusion. You're just getting your body to try something different, and it may respond better to it. Another thing to do is change up your nutrition. Like absolutely change up nutrition and make sure that nutrition exercise are in conjunction with Mounjaro. Nutrition is huge. If you're hitting a weight loss plateau, I would look at carnivore. I had a really cool one of my favorite patients. Oh my God, I love her. I love her. Came to me today. She's a type 1.5.
Okay.
Which too, type 1.5 is rare. Type 1.5 is very difficult to manage and to have too. I say that like it's a big deal for me. For her, it's very hard to manage. Like it's a difficult one because you're not type 2 and you're not type 1. You have beta cells that make insulin, but you have antibodies working against them. And a lot of that is with gut dysbiosis. That's a lot of where autoimmunity comes. She's tried metformin, which worked for a while, berberine, which worked for a while, some nutritional changes, which worked for a while, over the counters, and then Ozempic, and loved Ozempic, worked for a while. And then her sugars were getting wonky. C-peptide, which is a cleaving off of proinsulin to insulin, so it's how active your insulin is, was changing. She went carnivore, and she's done it for pretty religiously for 6 months now, I believe, off of everything.
That's incredible.
Off of everything. Weight is brilliant. Her sugars are, she showed me her sugars, they were like literally just 100. I've never seen anything like that. And that's from nutrition only. So I'd say too, to get out of a plateau, see where your nutrition's at, see our nutrition coach, Lucas, like get a plan and see what that looks like. Even with nutrition, after a little while, you have to change up too. But I think change up even too, Botox. If you do Botox for decades, change the toxin, try something different for a little bit if you feel like you don't respond as well.
Can I ask you, when you see a patient, and what do you kind of qualify as a plateau? Like what's the time span that equals a plateau in your eyes?
It depends. It depends on the patient because too, it depends on where you are with goal. Okay. Sometimes also to do a really good self-assessment deep dive into, am I like at a plateau or am I right where I need to be? I've worked with some people in the past that were really upset that they lost like 120 pounds and didn't lose more. I'm like, that's a whole person. I mean, you've lost a person. That's a good thing. So too, there's a lot of things to be like, you might not get and that is a hard thing to answer and to say, but you really might not get to, and I'm not speaking right now to you, Lisa, I'm talking generally, like people may not get to where they think they should be or want to be, but 100 pounds off, 150 off,
it's incredible.
50 pounds off, 20 pounds off, that's incredible. And so it's almost like, hey, I might not be where I'm at, but I've continued to lose for a really long time. And this is maybe where I need to sit for a little bit. It doesn't mean that you can't try things, but I definitely wouldn't let it get you down. I would say after about 3 to 6 months of doing consistently the same thing, I'd consider it a plateau.
One other thing, just for Lisa here, if there's anyone here with us live in the comments, if you've been through a plateau and have seen kind of the other side and started to lose again, put in the comments and kind of let us know what you did, what worked for you. That way we can share it with Lisa here with some different strategies.
And also too, if you've seen fire and you've seen rain, if you've seen sunny days that you thought would never end.
Are you playing James Taylor in the office?
You've seen lonely times where you could not find a friend.
I love me some James. Let's get to Roel here. Roel's asking, I have a family member, male, with a 6.0 A1C and having leaky gut issues. Not on any meds. Any suggestions? You're the perfect person to ask about this. What's your thoughts?
Oh, thanks. I love talking about A1C. So definition of A1C for anybody listening today. A1C is the portion of the red blood cell where sugar sticks. So hold on. Looks like this. Red blood cell, A1C. Red blood cell, A1C. That's sugar. And sugar looks like this. It's spiky and it cuts. So when it sticks on here, it cuts the artery. So that's what hemoglobin A1C means. Portion of the red blood cell where sugar sticks. And the higher, a more percentage coverage it is, the more opportunity it has to nick the arteries and the small arterioles that go to your eyes, your kidneys, and your feet. That's why those three complications are huge with diabetes. A 6% A1C gives us a definition of pre-diabetes. Anything over 5.7, between 5.7 and 6.4 is before diabetes or pre-diabetes. So not on any meds. I would start diabetes medications. Absolutely start diabetes medications. Start them before you actually, the A1C of 6.5 is technical definition and may be hard to have coverage for those, but you can start metformin, you can start berberine, the GLP-1s like Ozempic or GLP-1 GIP like Mounjaro. A lot of the newer, like every year, the Endocrinology Society and the American Diabetes Association put out new clinical guidelines for treatment algorithms. Most of the treatment algorithms are in stepwise approach. Start with diet and exercise, add something else, add something else, add something else. They used to do it very generically. Now it's what is your goal or what is the kind of root problem, which I actually really like these guidelines. You can Google them. You can look and say, is weight loss my goal? Is cardiovascular issues my goal? Is kidney issues my goal? And then it gives you actually different treatment guidelines. Leaky gut, so that means that the junctions that from the gut should be like this with a little bit of permeability, and now they're like this. That means things come in and start to cause usually autoimmune issues or gastrointestinal issues. With leaky gut, metformin might not be first choice, though it's the easiest because it can cause gastrointestinal distress. But two, I would start something. Look at gut health. Look at some of the diabetes medications. If you're looking at supplementation, I think starting with berberine, even though it can cause some of that GI stuff, anywhere from 400 milligrams a day to 1600, like 1-for-1 with metformin. I wouldn't be scared of starting metformin or Ozempic, depending on what the background, if you're looking for any weight loss with that too. Even dietary changes, looking at a low inflammatory diet, an autoimmune plan, or a ketogenic diet will reduce your insulin resistance. So nutritionally, you could fix 6% with nutrition alone. Hey, I want to shout out to Margot's in the house.
Margot is in the building. Let's put Margot.
Can you hear me?
Here.
Margot.
There we go.
Hey, so we're sending shout out. Margot's got a full day in Knoxville tomorrow, baby. And two, yes, Margot.
Yep.
Margot single-handedly sewed up
Amanda today.
Set up Amanda today, which is amazing. So too, not only can she make pretty sutures, she can also fix your hormones, your gut, your thyroid. Margot's amazing. I was actually with Margot's friends from the urgent care she worked at, where I met Margot, and they all just couldn't stop talking about her. They loved her. So we're very, very lucky to have her.
We love you, Margot. Thank you so much for being with us this evening. I'm going to put this up here from Fabian because it has to do with what we talked about with Roel. Fabian did blood work and his 6.0 A1C doctor saying Mediterranean diet. I know you're a fan. What's your thoughts on this?
So I actually like Mediterranean diet. I do. So Mediterranean diet, it's just rich in omega-3s. That's what it is, which is why it's inflammatory. And so for lowering A1C, it can help. I will tell you, I went to that conference last year, the A4M conference. All of it was on culinary medicine and nutrition. Every single person had a different idea. Everybody, every presenter that went up there said something different, but they all said the only one clinically relevant from studies supporting clinical nutrition and nutritional intervention is Mediterranean. That's the only one that's like on paper to show everybody agrees that's at least if you can't choose one, you choose that one. And so I actually love a Mediterranean diet because it's different. You get to eat a lot of different things. It's not boring. Sometimes with food, if food's boring, you won't eat it and you'll fall off the wagon. But Mediterranean, rich in omega-3s, that's in low in omega-6s, which is going to be very anti-inflammatory. So I like that one.
All right, let's get to Frida here on YouTube. Hey guys, hope you're good. Question, anything you recommend natural to help with reflux? Would love to get off Nexium, been on them for many years. What do you think about this with Frida?
So too, Robin, this may be something that I pitched to Robin at some point because Robin's our gut expert, or two, Lucas, because Lucas does a lot of it. a nutritional intervention is probably the most natural way you can fix reflux, is the things that you're eating. So that's number one, is cutting out, usually it's the fun foods, chocolate, acidic foods, spicy foods, tomatoes, lectins. The foods that containing lectins increase your reflux. Alcohol increases your reflux. Two, Nexium's a PPI, so that's a proton pump inhibitor. If you're going to do something that's maybe not natural, but still over the counter, I would choose an H2 blocker instead of Nexium. Nexium, you want protons. A lot of times you want protons, but histamine, you don't really want histamine. So I think a safer choice would be to look at Zantac Pepsidase C while getting off of Nexium. Nexium can be harmful to your bones over the long run, and you really want to use that more short term. Though everybody, you're not the only one. Everybody gets on these long term, and they're sometimes hard to get off. I would also, there's an at-home reflux test. Lucas would have to tell me more, but you drink something, and if you burp, it means you have low acid or high acid. I don't know off the top of my head, but a natural way is actually a lot of people get on hydrochloric acid and literally just take that, and that fixes your reflux. A lot of the times the reflux is actually low acid, not high acid.
Yeah, that's one big thing. One problem with these, I guess it's the PPIs, is they take out all the acid, and you actually need some in your stomach, which is super interesting. I hope that helps, Frida.
That's a tough one. That's a tough one too.
Thank you for that question. I want to get this in from because I just love this name, Gator Hater for Life. Go Vols. Question: visited PM for the first time.
Yeah, Vols.
That's awesome. And didn't have a chance to ask about peptides before the doctor had to go. I did have a normal testosterone level 306, but on the lower side. Do CrossFit, referee, very active. So what would be the best options for optimal muscle growth and weight loss? Great question. Very common question we get. What's your thoughts on this, Ange?
Next time that you're in the room with Dad and he leaves like that, I want you to look him in the eye and say, hey, I'm not done. Say, Andy told me that you can't leave this room.
You haven't told me about peptides yet.
And also, too, tell him, say, hey, Andy wants you to know your handwriting is really hard to read. Okay, get a computer. I'm just kidding. Don't say that. I'll deny I ever told you to say that. No, this is actually a great question because you have two things you're talking about. So yes, to normal testosterone level at 306, but also you're right, lower end. So too, you can absolutely bump up that testosterone with some natural, I call it biking on one end, Forerunner, Cadillac. Biking is going to be your naturals. How do I make bound testosterone unbound? So how do I increase my free and bioavailable? So there's products like Super Mira Forte, Boron, Bromelain, although that has some other side effects too, which are good side effects. Bromelain, and there's another product called Masculini T. Those are all natural proprietary blends that increase your free and total and bioavailable testosterone. My first guess is to get that 306 up. I would get that up. Even looking, depending on where you are in your life, Clomid HCG, those are GnRH agonists, which then increase luteinizing hormone, increases sperm, increases testosterone. That's the Forerunner. It's like Forerunner. It's very reliable, but you know, you're going to be in that for a long time. Cadillac, you gotta commit to Cadillac if you want testosterone to go up, and that's actually being on testosterone. So my first suggestion would be maybe look at different interventions if you didn't do one today, to increase that 306. And if you want to call me in Johnson City Clinic tomorrow, if we didn't start anything and you want to start it, we'll start it tomorrow if you just call me. But very active, referee high school basketball, CrossFit, you're a very active person. And I love that because your activity level on a lower side of testosterone, that's amazing. So you're utilizing all that T. Peptides, what they do is increase your growth hormone, your insulin growth like factor 1. Robin's got some great videos online. You're absolutely a candidate, and the best options for muscle growth and weight loss. I love the peptide therapies. Peptide therapies, all that means is put something in your body that pings something else. It kind of acts like a hormone, but it goes up to your pituitary and says, release something. And there's different formulas to release different things. With the peptides you're talking about, you're wanting to get more insulin growth like factor 1 and your own precursor to growth hormone, which is growth hormone releasing growth hormone. Everything has a releasing hormone. So that's how the peptides work. My recommendation would be CJC, IPAM. That's a combination. That's probably a little bit more potent than Sermorelin, although Sermorelin's another great option. The big difference is potency and price. I saw a comment in here about price. Yeah. CJC IPAM is pretty expensive. Depends on where you get it. The one we get from Create runs in like the 400s for a month's supply. It's expensive. Sermorelin's less expensive. And you can find resources online that you can get without a prescription. We don't recommend it, but have people done it and been fine? I can't say that out loud, but look at my head. Yes. But the one we have, I like the one we have. I'm always more for prescription, but price is sometimes a limiting factor to that. But I think absolutely for optimal muscle growth, weight loss, peptides, especially with how active my CrossFitters, my yogis, they love the peptides because they need to be stimulated with exercise. And so you're already doing that. You're going to get a lot of bang for your buck out of it. But I want to, shake a stick at doing some Clomid or even some of the natural stuff to bring that testosterone level up.
Great question there. I'm real quick. I just got to give a shout out to Tabitha. We've got so much of our PM team in here tonight, and they're just the best. Long day at the office, and they're with us here live tonight, as are you. Thanks, Andy, for this. This is incredible. Tabitha, of course, is in our Kingsport office. So if you ever are in the Kingsport office, you've seen Tabitha. Huge shout out there. And I want to get to Cindy's question real quick.
Yes.
And thank you, Shauna, for putting this up here. Shauna's saying, I love the honesty of this. So this is for Lisa and the Plateau. And ate some junk food for a few weeks. And then went back on a strict diet. Yeah. That's awesome.
Oh my God. Yes. Oh, absolutely. It's like muscle confusion. Like sometimes giving your body a little bit of a break. Yeah. Actually, Lucas at one point too, he did this routinely. So for 6 days, very clean, unprocessed foods, strict. And then on Sundays, he ate like garbage. Yeah. Like literal garbage. And two, he continued to lose. It's almost like you trick your gut into stimulating all the good stuff to fight the bad stuff you just put into it.
And I do think part of that, because I've heard some podcasts that talk about this very strategy, you do have to be strict on the days that you eat, on point. You need to be strict in order to kind of warrant that cheat day. Let's get to Cindy here. Cindy, thank you so much for being patient with me on this question. Question is, what is recommended for gout for male in late 30s, some alcohol consumption and red meat, supplements and prescriptions recommended? How do you go about this in the office? What's your thoughts?
Gout's tough. That's another thing I don't wish on people too. They used to call it the King's disease. So it's everything. I believe it's tyramine. God, Marco, if you're still in this comment, will you back me up on that? I think it's tyramine rich foods. It's either purine or tyramine rich foods cause gout. So everything a king would eat, which is alcohol, turkey leg, lobster, everything that was rich, they got gout. Even too, Queen Elizabeth, if you've ever seen The Favorite, that's a really good movie with Olivia Colman, Rachel Weisz, and or Weiss and Emma Stone. She has gout in it, Queen Elizabeth. And it is, or Queen Victoria. I think it's Queen Victoria. Unbelievable movie. But you see gout in all of its glory then. So they do the naturals too for it because that's all they had back then. Some of it's, I believe, tart cherry juice is one, like tart cherry juice, ginger, lemons, like vinegar, apple cider vinegar can help. But really tart cherry juice is for prostate and gout. And to that specific diet that is, golly, what was I going to say? A specific diet that's purine or tyramine, avoid it. You don't do those. That will help too. Prescriptions, you're looking at allopurinol and you're looking at colchicine. Those are the ones that you can take. Some are for acute flares, some are for chronic use. I'd probably try to get out of an acute flare and then try the naturals with nutritional intervention and tart cherry juice. But if it continues to be a problem, some people just carry uric acid. That's what is the main cause. You get uric acid crystals. There's something called gout and pseudo gout, and they get stuck in different areas and cause inflammation and pain.
Cindy, I hope that helps. Gout is such an interesting topic. I know it's a very difficult to deal with. So, Ange, thank you for that answer. Real quick, there is some discussion here in the comments around eggs. And I think, what did you recommend again? Because Lucas apparently was recommending free range as well. Is that kind of what your thoughts are? Free range, ultra pasteurized? Is that what you're thinking?
Yeah. Okay. Well, anything is close to like, so there's pasture raised, pasteurized, free range. So much of that too, if you look into like the not conspiracy theories, but like, people will say free range. It's like, well, is it free range, or do they have like 5 feet to move instead of 2 inches? Or pasture raised? It's like, well, is it really, or were they just fed grass? You really do want to find chickens that are actually outside and not in a cage. You do. Those are just I know this is stupid. If the animal was not happy and depressed and lonely, like, because animals have feelings just like humans do, because we're animals, you're not going to get a good product from that animal. The meat's not. It's almost like you're eating a sick animal. Yeah. So you want to eat a healthy animal that's out there in the wild. So I would say free range and pasture raised is good, but also kind of look into the company that you buy the egg from. If you're going to buy like kind of a chain of eggs, to see what it actually is, just to really do some research into it. Pasteurized. So pasteurization is going to kill bacteria. That's what it does. It's like milk is pasteurized. I think eggs, like pasteurized is more about killing bacteria, not pasture raised. Some people disagree with pasteurization. So some people will try to find raw dairy products instead of pasteurized dairy products, because you're getting the actual, like, pasteurization can kill a lot of the good stuff out of the dairy products as well, but you also are more prone to getting bacteria from them too. I think that's like a risk benefit. Closer to natural, better.
Cage free range. Okay, thank you, Molly, for that. That's from Lucas, our nutrition coach. I want to put this up here real quick. Guys, y'all have been incredible.
What a group! What a rowdy crew! I saw Rachel said, "Have you heard the good news?" I have. Oh, I've heard it. Have you heard the good news? Yeah. Oh, yeah, I've heard it. Have you heard the good news?
You know what? I think the good news was that you were on the show tonight, and I, for one, I'm going to give you a 10. Like 1 to 10. We like to rate ourselves at the end of the show, and you were a 10 tonight. Guys, what do you think? If you're with us live tonight, how did Andy do?
Oh my God. Y'all, I appreciate it, but I'm not much for live feedback. This is
I was a 10. Look at that. Dad would be proud.
Thank you. Cindy, thank you.
Yes. Thank you. Guys, if you thought Andy did a 10, let us know. I think he did a 10. Look at this. Molly's 25. I mean, a 25 out of 10. I didn't even know that was impossible. Look at this. Geez. Look at this. Look at this. Oh my gosh. 20 from Amber.
Yeah, Amber.
This is incredible.
That beautiful face. Look how beautiful Amber is.
This is incredible. Allison saying, great show, guys. I love it. So cool. So cool. Fabian's giving us a 10.
Oh no! Oh no!
6.
Hey, that's honesty. You know what? Only a true friend would be that truly honest. Okay, so I appreciate the honesty.
Rachel, we'll work on it.
I'll work on it. I'll get better. It's the lighting. Tim. Heck yeah. I just want to say, Ben right now is demonstrating something for us.
I know. I know what you're gonna say.
Do you know what I'm gonna say?
I do. Go, and I want you to tell everybody, because this is, circle of trust.
Circle of trust, and we're just going to share it with the group. Ladies and gentlemen, I bought Ben an Instapot for his birthday. Okay, like a good brother and sister. My sister and I, Kelly and I, we shared it, and we did joint gift. It was a month late. I know. Ben has used it once. His birthday was in February. Gave it to him in March. He's used it once, and it didn't work. is what he said. I don't know. It didn't work. Did you not press the button that says go? I mean, I'm not sure what didn't work out of it. And so Ben's been trying to cook at home has not helped. So too, Ben is on his way to Chipotle right now. Although Chipotle is actually pretty good and probably one of the better fast foods because they at least cook it right there. But can we encourage Ben? Don't let that lighting fool you, okay? Don't let that lighting fool you.
One thing that would encourage me, if anybody like has any good, easy instant pot recipes.
Yes, I got one, Ben. Put some damn meat in there and press go. It's that easy. Put meat and a little bit of water in there, go boom. And then 10 minutes later, you just de-steam it.
I've watched videos and it is confusing. It is like, do you press steam or do you press, and then like, how long do you steam it? I feel like the directions I've read were confusing. And I was thinking it was going to be like
you just press go. You just press go. And then it's like, it's usually, they'll tell you, it's like, oh, about 9 minutes. Boom, go. 9 minutes, high steam, high pressure, just go.
All right, guys. If you have any Instant Pot recipes you like, let's put them in the comments. I'll be looking at those tonight. I do want to improve in this area of my life. And, I'll be checking back in with everybody each Tuesday just to tell you how I'm doing on this journey,
Hey, Ben, I make fun of you, but I do love that journey for you. Look at that glowing skin. Look at that face. Oh, my God. How can you beat it? How can you beat it?
Real quick, I'm going to put this up from Roel, then we're going to call it a show. High protein diet, red meat, white and dark meat, and feels amazing when hungry. She eats fruit medley like strawberry, blueberries. Okay, that's what I thought.
Oh, beautiful. Too, the berries are high in antioxidants. Of any of the fruits, I think that's best. Too, you get a little bit of different like processes with the white and dark meats. Some say it's like fast twitch, slow twitch muscles for like different muscle fibers that you're getting off of it, which I think is great. High protein is amazing. High proteins and making sure that there's good amount of fats in there too. I think fats are really good for us. But the berry choices, those are by far the best berries. Yes. Too, they think anything too with fruits and vegetables, it's what's endemic in your area. So like whatever if you live on an island and you're used to eating bananas because you've always been from there, you'll probably digest bananas well. But here in the mountains of East Tennessee, we're going to be more berries, more apples, cherries, things those are going to be more endemic to our area. So I think that's a great thing.
Thank you for that, Roel. And man, thank you.
You're the man. Thanks for this. This is great stuff, y'all. Great stuff.
I love it.
Thanks everybody for joining in. This is like way more fun than I expected to be. I'm not much of a
This was incredible. Guys in the comments, we love you. Andy, I love you, man. Thank you so much for hanging out.
I love you too, bro.
You're going to be coming back on the show here in a couple weeks. Guys, he's going to be with us live. I'm going to be back with Dr. Rogers on next Tuesday. Next Tuesday, 7, we do the Performance Medicine Show every single Tuesday, 7 p.m., YouTube and Facebook. Come join us every week. You guys are the bomb. We love you. The questions make the show amazing. So thank you so much for all the different questions that came in throughout the week, as well as live with us tonight. D. Lynn, I see you. Thank you so much. We love you for being here. Grandma Mary, I love you. Andy, I love you, man.
I love you too, bro. You are my favorite brother. You are.
Guys, where's my outro? Brad, take us away, okay? Brad, just take us away.
Don't go away.